What I want to do in this talk is consider the factors in Virchow's triad and consider how these can contribute to the etiology, to the causation of venothromboembolism. So we've noticed that one cause in leading to thrombosis is increased coagulability of the blood. That can lead to thrombus formation. We've also noticed that it can be caused by disorders of the vascular endothelium, the lining of the blood vessels. And I've also noted that it can be caused by stagnant or abnormal blood flow. So these are the three groups of factors. So rather than just look at a list of factors altogether, I thought we'd try and improve our understanding by thinking about how etiological factors fit into these three categories. So first of all, we'll look at increased coagulability of the blood. So increased coagulability of the blood as part of the causation of venothromboembolism. So increased coagulability of the blood, that's in red. Now, this is called hypercoagulability. Hyper just means high. So the blood is more likely to coagulate than normal, more likely to clot than normal. And there's different reasons for this. And one of them is cancer. Now, in cancer, you get direct effects of the tumour, but you also get indirect effects of tumours as well. These are sometimes called paraneoplastic effects. And cancer will actually increase the coagulability of the blood. So it's not that uncommon that cancer actually presents as a DVT or a pulmonary embolism. So if a DVT or a pulmonary embolism just come out of the blue and someone who's got no history of it at all or no obvious risk factors, then it's always just worth thinking about that possibility that it could be caused by a cancer. Thankfully, of course, the majority aren't, but cancer does increase the coagulability of the blood. Chemotherapeutic drugs can be a factor because these are very insulting. Now, where the chemotherapeutic drug is put into the bloodstream in the vein, then certainly that can damage the wall of the vein, but this can be in effect everywhere as well because of the very toxic nature of chemotherapeutic agents. Now, surgery or trauma can increase the coagulability of the blood. Now, as you probably know, or as is fairly obvious, in surgery and trauma, there can be bleeding, blood loss. And in order to stop the blood loss, the platelets are going to coagulate, stick together, to initiate the full coagulation cascade. So what this means is, if there's injury, in order to stop the hemorrhage, the platelets can actually be used up and there can be a reduction in the number of platelets. But to compensate for that, the bone marrow produces lots of new young platelets, lots of new young thrombocytes. Thrombocytes, of course, and platelets are exactly the same thing. So that means that after blood loss, then, for example, surgery or trauma, then a few days after that, there's going to be more young platelets than there would be in the normal physiological situation. And these young platelets are more sticky, more likely to initiate coagulation than older platelets that get a bit tired and a bit worn out. So after surgery and trauma, a few days after, the young platelets, the increased population of young platelets in the blood can increase the possibility of the blood coagulating. Dehydration's a fairly obvious one. If there's dehydration, then there can be reduction in the plasma component of the blood and the cells become more concentrated. Infection and sepsis can increase the coagulability of the blood as well. And in extreme cases, there can be a condition called disseminated intravascular coagulation, which I'm not going to go in here, but I think there's other videos on it. Combined oral contraceptive pills, estrogen and progesterone pills can increase blood coagulability. And also in late pregnancy there can be there's an increased risk of DVT-PE because of increased coagulability of the blood. And this is actually a physiological change in late pregnancy, because in late pregnancy the body knows that the delivery process, labour and the delivery birth-giving process are about to take place, and that will be associated with blood loss. So in late pregnancy there's an increased coagulability of the blood to anticipate the blood loss and therefore reduce the blood loss that occurs during labour. But a side effect of that can be thrombus formation, an etiology of venothromboembolism. Other conditions you might think of, sickle cell disease is one. That's an inherited condition. Polycythemia is a condition where you get, it's more of a descriptive term really, polycythemia. It describes an increase in the hematocrit, an increase in the number of red cells. And of course people that abuse erythropoietin and inject EPO are going to be more at risk of DVT-PE because of increased blood coagulability, because the blood's going to be thicker. So a few things there in terms of increased coagulability. Next, let's consider disorders of the vascular endothelium. And again, we're thinking particularly now about disorders in veins. It's venothromboembolism we're talking about, because we know that in the arterial system, atheroma is by far the most common cause of thrombus formation, and that is a disorder of the vascular endothelium. But veins don't get atheroma. You don't get any atheroma at all in veins. So disorders of vascular endothelium, what can happen is this is descriptive. It can alter the dynamics of the blood flow. So the blood can be swirling around about obstructions and things. Now, smoking, because of the toxins in smoke, they can actually damage the vascular endothelium directly. And that's one of the reasons why there's increased coagulability in smoking. Actually, we could have put smoking in this one as well, increased coagulability of the blood, because smoking is going to increase platelet viscosity, thrombocyte adherence. So we could have put that there, and we've got it here as well. So there's the message, don't smoke, because it can damage the vascular endothelium as well as increasing coagulability. Thrombophlebitis, so itis is inflammation, phleb is vein, so that's when you get thrombus formation as a result of usually infection in a vein. Cellulitis in the tissues can damage the vascular endothelium as part of the infective process caused by the production of bacterial toxins, very often staphylococcal. And physical trauma is another factor that can damage the vascular endothelium. And this does overlap to some extent with the sluggish or abnormal blood flow, which we did in blue. Combining these two, really, there's a fascinating story from in my country in 1939. There was bombing, we call it the Blitz, and Londoners were being bombed, so they escaped into the underground stations, and they just were told to go down there. So what they did was they picked up their deck chairs, their old-fashioned deck chairs, and they slept on the deck chairs overnight. And one week there was 23 deaths through pulmonary embolism, DVT-PE, and this was investigated by Dr. Keith Simpson, a local doctor at the time. And of course, he knew that the pulmonary emboli were caused by deep venous thrombosis. And what he found was people were sleeping on these deck chairs, and their thigh muscles were like leaning over this wooden board all night, and that was causing disorder of the vascular endothelium, and it was also causing sluggish or abnormal blood flow from the pressure through the thigh muscles into the veins. And what he did was he banned deck chairs from the underground and introduced bunk beds, and the incidence of pulmonary embolism went from 23 in the week to 0 in the weeks after that. So a combination of these two factors. So sluggish or abnormal blood flow. Well, here we're talking about venous stasis. That's kind of a descriptive term, but that's what's happening. And this is more common with increasing age. Now, it's certainly true that there's more venothromboembolism with increasing age. Reduced mobility is probably only one factor, but it is one factor. Prolonged immobility in anyone is a risk factor. So we might think about a patient undergoing surgery who is immobilised on the operating table for a period of time. And as well as being immobilised, what anaesthetists will often do is they will give drugs to relax the muscles, muscle relaxing drugs. This is so the surgeons can get into cavities and open them up. But that has the side effect of reducing the muscle tone in the leg muscles. And therefore the component of venous return, which is facilitated by muscle tone, is lost. So surgery is a particular risk factor because of that, especially if muscle relaxants are used, as well as the period of inactivity. But we could also think about prolonged immobility in your work situation. Are you immobile at work? Do you work behind a computer for 10 hours a day without moving very much? Or we can think about situations in travel, long haul flights, long bus journeys, especially where you're cramped up, where there's going to be sluggish or abnormal blood flow because the venous return is dependent on the contraction of adjacent skeletal muscles. Now, atrial fibrillation is also a particular risk factor. Now, there's part of the left atrium which is essentially a blind-ended pouch. It's called the left atrial appendage, the left atrial appendage. And about 15% of ischemic strokes actually are caused by atrial fibrillation. So normally the atria are contracting, normally, but in atrial fibrillation there's no contraction. So there's no contraction of this atrial appendage, and the blood there is much more likely to coagulate. It's a bit of a nuisance, really. I mean, it does have a purpose. The atrial appendage produces atrial natriuretic factor, for example, controlling pressure and sodium in the body. But in atrial fibrillation, when it's no longer actively contracting, that's where emboli are likely to originate, because that's where thrombus formation is likely to occur. So atrial fibrillation, a particular risk factor. That's why people on atrial fibrillation will normally put them on some sort of blood thinning medication at a fairly early stage. Valvular heart disease is strongly associated with sluggish or abnormal blood flow, and again that can result in increase the likelihood of mural thrombus formation in the heart. So a mural thrombus is thrombus that sticks to the endocardium of the heart. Right heart failure, as we'll look at when we look at the diagram of the circulation in more detail. Surgery and trauma we've mentioned. Both of these can cause immobility, as well as the effects that we saw on the thrombocytes. And anything that causes venous obstruction is going to increase the risk. So obesity is going to exert pressure on the inferior vena cava, meaning it's harder for blood to get up from the extremities of the body, from the legs, back up into the thoracic cavity. So people with obesity are going to be more prone to thromboembolism. Tumours are another risk factor, and pregnancy again. In this case, because when we're thinking about sluggish or abnormal blood flow, purely because of the pressure effect of the fetus on the inferior vena cava. So we've got those interesting factors there. We've got hypercoagulability of the blood as an etiology of VTE. We've got the sluggish or abnormal blood flow on that circle, and the blue circle, and we've got the disorders of the vascular endothelium on the green circle. And it's fairly obvious that, just like Keith Simpson, you can think about what's causing venothromboembolism in your patients and in your populations, and give them specific advice on how to reduce that. Just before we finish this section on causation, I think we'll probably mention that most pulmonary emboli are from deep leg venous thrombosis, or indeed from veins higher up, even as far up as the iliac veins. But there are some rarer causes of pulmonary embolism, because remember, a pulmonary embolism is just something moving through the circulatory system that has the potential to block a vessel. And other causes of pulmonary emboli include amniotic fluid, it's a complication of pregnancy, part of the placenta, again as a complication of delivery. Air emboli are a possibility if you introduce air into your patient's circulatory system because you haven't primed your giving sets properly, or you haven't primed all the equipment for intravenous administration. And again, there are full videos on that if you want to watch them. Fat emboli, these tend to occur after long bone fractures. The reason for fat emboli, fat pulmonary emboli, are complicated. Partly it's when the bone breaks that fat escapes from the medullary cavity of the bone, but there's all sorts of metabolic effects associated with fractures as well. But suffice it to say that after long bone fractures, there can be a sudden deluge of fat into the blood, and this can clog up the pulmonary arterial system. Tumour can break away and metastasize and lodge and form a pulmonary embolism, and there can be septic emboli from endocarditis as well. So they're sort of non-blood clot causes. Less common, but the vast majority of causes are the blood clot causes, and as we've seen, these can be explained by the factors of Virchow's triad causing venothromboembolism. And of course, venothromboembolism is another way of saying deep venous thrombosis and pulmonary embolization.